Well, hello and welcome to this live. We are here live on YouTube and on Facebook to talk about health and climate change. My name is Jeremy Wilkes. I make a program on Euronews all about climate change called Climate Now. You can see a link below in the description to watch some of our programs. And this week we've been having a look at the question of health and climate change, talking to different guests who I'd like to bring on board. Here we have Professor Jan Semensa, who you may have seen in our programme if you're watching Euronews. He's from the European Centre for Disease Prevention and Control. We have Carlo Buontempo, who's the director of the Copernicus Climate Change Service, and Francesca Di Donato, who's from the Lazio Regional Health Authority. Thanks for being with us. I'm here in France. Where are you, Jan?
I'm in Stockholm right now, in Sweden.
Carlo?
I'm in the English countryside.
Wonderful. Francesca?
I'm in Rome, in Italy.
Okay, brilliant. Well, look, we're here to answer your questions about health and disease, and from anywhere all around Europe, we really want to hear your questions, what you want to know about. I'm going to go straight into it. We had one from Nasser Amini, who asked us which types of diseases are related to climate change, and I'm going to go send that one to Jan. What kinds of new risks and things do we have in Europe because of climate change?
Yeah, that's a good question. We asked that question also. We tried to analyze all the infectious diseases that are linked to climate. And so we were able to make a big ranking of the ones that are strongly associated with climate and climate change and the ones that are not. And then we asked ourselves the question, well, is that important? So if a disease is strongly associated with climate change, does that matter? And we decided not really, because just because it's associated with climate or climate change doesn't mean that we need to do anything about it. But what we did, we mapped it out against the impact on society, the severity of the consequences. So if this particular disease doesn't do much harm, doesn't cause any deaths, or people don't get really sick, we don't need to be worried about it. But if the impact is big, high mortality, high morbidity, then we need to do something about it. And basically, we came up with 7 diseases that we don't really have a handle on when it comes to surveillance in Europe. And those were infectious diseases such as Lyme disease, tick-borne encephalitis, West Nile fever, Vibrio infections, leishmaniasis, and Rift Valley fever. And we basically decided that something needs to be done about those because they're both associated with climate change and they have a big impact on society. And in fact, after we published that paper, the European community came together to put a surveillance system in place for TBE and Lyme disease, and we developed a system for Vibrio, and a lot of things have happened since, also for dengue and other diseases.
And those were new. Those were new in Europe in the last 10 years or something.
Yes. Those surveillance systems were just recently implemented for those diseases that were identified to be not reportable, and we didn't have any control, any check on the spread of those diseases in Europe.
One of the things that's bringing diseases, tropical diseases, some of the things you're talking about there, into Europe is these Asian tiger moths. Can you talk to us a little bit about those, about how they're spreading? I know they're in my region now, and they weren't before. Where are they going, and how are they moving around?
Yeah, so the Asian tiger mosquito is an invasive species. It's very aggressive, and it was imported into Europe in 1979, into Albania, and then into Italy, in northern Italy, in Venice and in Genova. And it has been spreading in northern Europe ever since and has been expanding along the Mediterranean and further north.
So it's basically moving because of climate change, or is it moving because of other factors as well?
That's a good question. So we believe that climate and climate change is a contributing factor, but it's not the only one, because we have seen it expand along transportation corridors. So these transportation corridors are a strong factor for the expansion, but climate contributes also. And this invasive species is taking advantage of the ecologic niche, a habitat where it can survive. And if the climate is suitable, it will just expand even faster.
I'm going to get on to some of the other questions. We can come back to some of these questions about mosquitoes, but to some of the other guests that we have here. Will climate change affect the number of allergies a person may have? We had from Philip Matchevich. Is there a link between, well, the number of allergies you may have or when they come? Carlo, is there anything you can say about that?
Well, clearly, I'm not an expert on the allergy per se, so I don't know about the human reaction to climate change. But there is something we can say there, and is related to the change in the, in the way plants reach the flowering state. So the growing season is changing as a consequence of the warming trend associated with climate change. And this means bringing flowering early in the season, which may change the timing of allergy. So we may have new allergy, but we can also have allergy happening at different time of the year, either before or later than they used to. And this may have consequences for people.
Yeah, basically the timing's changing. So the same sorts of things are happening, but they're arriving at different times of the year. I want to talk about COVID-19, and I want to talk about heat waves, because Francesca and I had a very brief chat about this, and you made a very important point, which is that the people who are considered at risk of COVID-19 are the same kind of people who are considered at risk from heat waves. Can you talk to us a bit about that? What kinds of work is going on at the moment in that area?
Yeah, so obviously we're moving towards the summer season for Europe. So as we expect, we're going to have higher temperatures and potentially heat wave events. And we know that from the literature, from epidemiological studies, that not all people are susceptible to heat in the same way. For younger people, you might just feel hot. For elderly people, people with chronic conditions, this can actually cause some very severe health risks as well. You could be hospitalized, or you could even die. And some of these subgroups are the same ones that we've been seeing as being most at risk from COVID-19. Not only the elderly, but people with cardiorespiratory disease, kidney disease, diabetes have had a higher prevalence of death related to COVID. And so we really need to look at these subgroups that are most at risk and look after them, not only for COVID and see that they're okay, but also during heat waves. And then if we think of prevention measures and everything that is in place in Europe, obviously the public health sector is under a lot of strain, has been for the past couple of 2-3 months as well. So how we can actually contact subjects at risk and survey them throughout the summer has to be adapted to the new contact restrictions we have related to COVID, or access to services and pharmaceuticals, treatment and whatnot. So
what kind of things are actually going on? What kind of things can governments and local authorities actually do to try and get ready for that situation? I mean, you're saying it's kind of on the horizon. What can they do really?
Yeah, well, so every summer, most countries in Europe have heat plans in place and in action. So these will start now. This is the preparation phase. So new activities are set in place. Warning systems will start. So they will alert the public health sector, emergency response services during heat waves to inform them that there is a heat wave approaching, and a series of both emergency protocols and other measures are put in place specifically to address an increase in hospital admissions or severity in elderly subjects, or having to change and do different things at community level, but also at regional and national level. So plans are in place, and most countries are now adapting together with WHO and WMO. They're revising these guidelines and indications to include specific actions also related to COVID-19 and what we're living in these past months.
We've had a question from Max, who's asking about basically, I think he's saying that Europe and North America used to be relatively kind of safe-ish places, but there's kind of a change because of climate change. What can you actually do to actually protect yourself? I mean, Europe, for example, can it do anything, Jan, to protect itself against these things like tropical diseases that are coming in here now? Is it just an inevitable consequence of the fact that it's warmer?
Yeah, so we asked that question, and we asked ourselves, what are the most important drivers of these type of diseases? And when we analyzed all the epidemiologic we call it epidemic intelligence data. We found that tourism and transport in international air travel is the strongest factor that imports these type of diseases into Europe. But then climate and climate change is a contributing factor to the onwards transmission and the further spread of these diseases. And we have basically set up systems where we're trying to monitor the air passenger volume from these dengue active areas, for example, or chikungunya active areas or Zika active areas into Europe, and then the climatic suitability where these pathogens are reported to see how it can potentially spread. So then we set up surveillance systems where we monitor areas of importation to see if there's a potential outbreak in order to contain it as quickly as possible. So there are lots of things we can do when it comes to early warning systems and trying to be prepared for these changes that are coming down the pipelines due to globalization and international travel.
Yes, what you're talking about is somebody brings it in on a flight, and in the past 30 years ago, it wouldn't have survived very long in that place because the climatic conditions weren't okay.
And as you mentioned earlier, now we have the mosquito that can transmit that new pathogen from one individual to another. That mosquito didn't exist in big parts of Europe before, right, and has been now imported. It's spreading very quickly, and so now we have the combination of the pathogen, the tropical pathogen, and the tropical vector, and then you can see the disease spreading in European populations. And so we're trying to make sure
globalization and climate change all coming in together.
Exactly.
Yeah, so it's not just a kind of climate change thing. No. There's a question about when will the EU states start acting, which came from DC Mike 98. Thank you for that question. I'm not sure we're here to discuss politics, but Francesca, you speak to governments a lot. Are they kind of aware of these evolving issues? Are they things that people are concerned about?
Yeah, I think there's general awareness of the potential risks. Obviously, it's a very broad topic. I mean, climate change covers and envisions a whole series of problems and risks. So if you think about it in terms of policy and governmental action, it is quite complex. So, putting it under one domain is very complicated, and I think it is being addressed separately in different fields. I mean, here we're talking about health, and so it's in a way one aspect of it, but it's a very complex aspect as well, and that makes it difficult as well to know whose jurisdiction it goes to in all the different aspects. That doesn't mean that they don't have to do anything, and I think they are, but I think it adds to the complexity of knowing where to start and what to do in the different fields. I mean, it's an ongoing process. If there's a lot that has been said about adaptation and mitigation strategies in terms of climate change. Most governments and at different levels have acknowledged this and let's say tackle them from both perspectives. But it's still an ongoing and we're at the beginning of a very long process, I think.
Yeah, and it's interesting, we're talking about adaptation. We mentioned it briefly in our report for Climate Now with Jan in the Baltic, and this was an example I was surprised about, because let's say when it comes to climate change and disease, I've heard about the mosquitoes and the more tropical things in the south, but there are also issues around in the countries that go around the Baltic Sea because of this Vibrio bacteria that lives there in that water, likes the brackish water. That's kind of where it likes to be, and then it gets warmer and the temperature rises. As soon as the temperature gets above 15 degrees, there's this curve of growth, right, Jan? And they're everywhere. And you've set up a warning system for the countries around there. Tell us a little bit about the system. Tell us a little bit about the bacteria as well, but what it can do to you, how dangerous it is.
Yeah, it's a nasty bacteria. They're called Vibrio bacteria, and they can cause wound infections and blood poisoning, septicemia, that have a case fatality rate similar to Ebola. So they're very dangerous, and people die from that during hot summer months. So we have set up a system where we monitor sea surface temperature and salinity worldwide, but we have calibrated for the Baltic because now it allows us to identify certain beaches, a certain bay that's at increased risk for these bacterial infections, and then we can alert the public that they should stay away from that beach, impose beach closures, and alert physicians and the public about the potential threats. So this is a monitoring system where we use satellites to monitor sea surface temperature and salinity, and then we see certain high-risk areas, and we can communicate that to decision makers around the Baltic to protect the health of the public. So this is an adaptation strategy because the sea surface temperature in the Baltic has increased over the years due to climate change, and we have seen more and more of these infections due to climate change. And our adaptation strategy is to monitor the conditions so we can avoid exposure and tell high-risk individuals not to go into the water when the conditions are ripe for infection. So it's a monitoring system and it's climate change adaptation. And that's an example of what Europe is doing to protect the health of Europeans.
Another one that you talked to me about, which I was also surprised by, is ticks, because again, where I live, we're aware of a tick threat, but I'm in a river valley, quite low altitude. Lyme disease is definitely an issue here, but they're moving up hills, they're moving up in terms of northwards. That's kind of an emerging threat too, right?
So there are studies that document that these ticks have been moving up into mountains, so higher altitude, but also higher latitude here in Scandinavia, where they're going further north because of the warming. And so once the ticks expand, then they can help the disease transmission, and we see more and more of those type of diseases because of this expansion of these type of ticks. And as you mentioned, tick-borne encephalitis is a dangerous one. The good news is that there is a vaccine for those, and then there is Lyme disease, for which there is treatment but no vaccine. So there are certain things that we can do about it, but the best thing is try to avoid exposure, protect your ankles and your legs when you go hiking. Don't go through the bushes if you don't have to. Try to stay on the paths, because those ticks can carry dangerous viruses, pathogens such as TBE virus or the Lyme borreliosis bacteria.
We had a not really a question, but a comment from somebody calling himself Tarshan Glitch, who says that Leonardo da Vinci once said, "Everything is connected to everything." Was being very profound, but I suppose this is one of those issues where you realise that things are connected in ways that you weren't necessarily sure they were, because we hear about climate change, it's quite an abstract concept a lot of the time because it takes a long time for it to happen. And now you can say, I feel that this is a change that's happened near me. Across Europe, generally, is there more awareness of these issues? Just literally on a public health level, is there more awareness? I mean, I'm sure you're launching campaigns and different organisations are, but is there generally more awareness, or is this actually something where there isn't enough communication about the risks that could be out there?
I personally don't think so, because if you think about the 2003 heat wave that hit the southern part of Europe, if you calculate the excess mortality of that particular heat wave, you come up to something like 70,000 individuals that died due to that heat wave. And that heat wave was a climate change event, because it was such a statistical outlier that it could have only been caused by climate change. And if 70,000 people is not a staggering number, and if people don't wake up to that kind of a number, then I don't know what will. I mean, that's a huge impact on public health.
Absolutely. And Carlo, in terms of you speak to government organisations as well, do you have conversations about these issues related to health very much when you're speaking to governments? Are they concerned about those things, or are they worried about other climate change issues?
I think they are worried about all sorts of issues, so health being one. And at this stage in time with the COVID outbreak, I think everyone looks at health with a particular care. But what I found interesting in the discussion we heard from you and from Francesca is this requirement for up-to-date, high-quality data. So this being SSTs for the Baltic or information about heat waves. So I guess one of the things that government needs to be to develop policies to progress regulation and the like is to have access to good quality data produced routinely that can then be used to make and inform decisions.
I'm going to bring up one of our graphics, actually, which relates to one of the things that you're doing at the moment, which is at Copernicus. You're trying to work out between COVID-19 and temperature and humidity, whether there's any relationship between the two. So we'll bring up that graphic now soon. But Carla, could you talk to us a little bit about this concept, this explorer that you've launched?
Yes. So especially at the beginning of the epidemic, there was quite a bit of attention for a possible link between the outbreak and the climate. So other coronaviruses, and I'm not an expert on those, but other coronaviruses are known to exhibit a strong seasonality. So the outbreaks tend to be mostly happening in winter, and when the summer arrives, they typically recess or disappear. So the question was, this is a new virus, we don't know how it behaves, but is a reasonable hypothesis to imagine that it will show a similar behavior. So there were a few publications put out, some of which suggested an interval of temperature or an interval of humidity, under which, so environmental condition under which the spread may be more pronounced or facilitated. So what we did in this occasion was to put together a system that monitors this variable and make them available online on an easy-to-use interface, alongside information about mortality. So if the link is strong, then you would expect to see it emerging from a plot like this. So we don't take a side. We don't know. It's new. We don't know whether seasonality will play a major role. And if anything, the evidence seems to suggest that it will play a role, but not a vital one, not a very strong one. Nevertheless, having high-quality information out there allows the authorities, in this case the European Commission, but also organizations such as EANS, ECDC, or the national authorities, to make the call, to decide how important seasonality is for them. So it's really a way to show what wealth of information we have available that can be used for these sort of decisions.
Yeah, a question of pairing up the right sets of data, I suppose, isn't it? And trying to work out what the conclusions are. Jan, we talked to you about this in our program as well, about, I guess a lot of people also at the beginning were thinking, it'll get warm, it'll disappear. COVID-19 should disappear. What's your opinion on that?
Yeah, well, so that opinion is based on the fact that there are 4 coronaviruses that circulate in human populations all year round. I mean, for an extended period already. So there are 2 alpha viruses and there are 2 beta coronaviruses, and they peak in the winter months and then they disappear in the summer. So of course we were hoping that the same thing would apply to this new coronavirus, also that it will disappear in the summer. But all the assessment indicate, as Carlo just mentioned, is that the epidemic curve is going to come down by maybe 20%, but not sufficiently enough to be completely be driven into the ground during the summer months. So we will still have transmission, we will still have outbreaks, even if it will dampen the epidemic a little bit, but not sufficiently to bring it down to 0. So we hope that the summer will help us out. It probably will a little bit, but not sufficiently to stop the epidemic from happening in the summer months. So we're probably going to see more outbreaks and then another wave in the fall that follows that.
Your expectation would that in any case it'll go up and down according with the seasons.
Yes, exactly. Yeah, but not disappear entirely. It might do that in future years once population have built herd immunity or enough immunity in the population to slow the virus down. But currently everybody's susceptible, everybody's new to this virus, so you will have transmission, and the climate can dampen it a little bit, but not sufficiently to stop the transmission. That's the current assessment, but nobody knows.
Are there places where climate change is actually making the disease risk better? I mean, like fewer risks.
You mentioned chikungunya, which is another tropical disease in Europe that we have seen sporadic outbreaks, and we have seen an expansion. We predict an expansion in the Rhone Valley and in the Rhine Valley, but we also see a contraction in Italy, in the Adriatic coast, because of a prolonged number of summer droughts. So it's a give and take. It's not all bad. Certain areas might actually see a decrease in disease transmission due to climate change. But again, those are our projections, and it remains to be seen.
We had a question from Mohammed Zouini, who said, if this is true, how can we confront the risks? I mean, we've talked about that a little bit already, but basically he's talking about climate change and increasing risks. How do we confront them? What can individuals do? What can organizations do? I suppose first off, Francesca, what's your feeling on that? What's the best kind of answers that we can have to dealing with some of these climate change related health issues?
Well, yeah, I think going back to the question before on, having a holistic and more overreaching approach is important, because it's not only a top-down, from government and institution and policy, it's also from an individual level, which not only is an opportunity. There have been several studies looking at the co-benefits of climate change mitigation and adaptation measures, which are really important, and health has an important role again here, because if you think of mitigation measures whereby using, not driving your car, walking, and having a more healthy lifestyle can reduce greenhouse gas emissions, it's a win-win situation here, because it improves individual lifestyle and health conditions, as well as reducing the emissions and the negative impacts, or slowing down climate change, which is an added value, and that is especially true not only for health but for the environment, so where we live in as well. So if you think of it in a wider extent, that's also really important. So I think it has to be seen from different perspectives, and what we can do has to be, it doesn't only have to be down to the individual or community level, but it has to be from different approaches and different means as well, and that is very important here. And I think it's the way forward. We should start looking at the benefits, as well as continuing, with the research in showing what the risks are, where the impact areas are, and what the risks and where they are. That is very important, as we are seeing it now for COVID. It's new, we don't know anything, and a lot of research has been produced in the past 2 or 3 months, but we're only at the start, as Jan was saying as well, and we do need data, and we do need information, as Carlo was also suggesting, but we also need to see the opportunity. And I think in climate change there are a lot of opportunities to improving, living conditions, reducing health inequalities, not only in terms of health inequalities, but socioeconomic inequalities around the world and whatnot, and try and envisage it as an opportunity. And I think research, not only from a health perspective, but also in terms of climate change researchers like Carlo, really have an important role in promoting and giving policymakers the tools and the information to make it a proactive movement and decision into that area. But again, some things are still going to happen. We can't expect them to disappear, and adaptation and rapid response is crucial at the same time as for heat waves.
Yeah, absolutely. I'm going to call up one of the graphics that we've got, which is a projection for the future, because we do have these kind of projections, because you've got a ton of data, the ability to crunch it with huge, powerful computers, which Carlo has, in order to try and have a look at where things are going in the future. This particular graphic is actually showing us what will happen to the tiger mosquito, Asian tiger mosquito, and the kind of risk areas. Obviously, those are the ones in darker red. And here we're looking at a scenario for 2071. Jan, can you talk to us a little bit about this? Basically, you're saying that, for example, up in the UK into Scandinavia, you're going to start to get these mosquitoes, which could potentially be carrying deadly viruses. Not deadly viruses, in fact, just viruses that give you nasty diseases you don't want.
Right. So, just the fact that it comes to Scandinavia and England doesn't mean that we're going to see outbreak necessarily. So it is possible that the mosquito can establish itself in those areas, but whether there will be sufficient mosquitoes to be able to drive the epidemic is a totally different issue, and that remains to be seen. And I don't necessarily believe that that will be the case. But what you can see on this dramatic map is that there's a big ecologic niche for this mosquito, this invasive mosquito, to fill, and it will probably expand throughout the European continent, because the conditions will be suitable and become more suitable in the future. So that's the bad news, because they're a nuisance. But besides the nuisance, of course, we are concerned about the diseases, and we have severe diseases like dengue, chikungunya, and Zika as examples that we're concerned about. And particularly around the Mediterranean, there is a risk of these type of outbreaks, because we have seen that the climatic suitability in the Mediterranean has increased over the years dramatically ever since the introduction in 1979. And we have seen more and more of these kind of outbreaks as a result. And again, it's not just climate. The climate is also a factor. So the combination of importation of these pathogens into Europe and increased climatic suitability due to climate change favors these repeated outbreaks that have occurred more and more in the recent years.
Surely you're going to face a bit of a problem, though, aren't you, in convincing the people of Scandinavia or southern England that they need to be concerned about some Asian tiger mosquito, which sort of thing they encounter only when they go on holiday?
Yes, I agree. I will be adapting to that new reality once we get there.
Yeah, certainly there were lots of public information campaigns around where I live in along the Rhone Valley in France, so just to try and just raise awareness of what this thing was and what it could possibly do.
Yeah.
What about malaria? Is that something that we could start to have cases of in Europe?
So malaria is transmitted by a different mosquito, and this mosquito is indigenous. So this mosquito exists in Europe, but as you know, we have malaria throughout Europe, even in Scandinavia, in the southern part of Scandinavia, there was malaria. Okay. We do not think that climate change will result in a big malaria epidemic in Europe, because there are lots of other factors that control, that determine malaria outbreaks. And so socioeconomic development, land use patterns, population density, and other factors play a role there also. And so we do not think that climate change will lead to big malaria outbreaks in Europe.
Okay, well, it has been absolutely fascinating talking to all of you, and I'm going to wind things up there. It's been great having this conversation. Thank you to Jan Semenza, Carlo Buontempo, Francesca Di Donato. It's been just great having this conversation, starting to open up some of the topics and hear a little bit more of the detail. And please leave your questions and comments below. Let us know what you'd like to hear more about as well. And we've got more of these lives coming up every month for the rest of this year, so you can hear more from us and your questions, the themes you're interested in. And thanks a lot for watching, and we'll see you again soon. Thank you.
Thank you.